My name is Architect Fiifi Awortwi, a member of the architectural team and Deputy Project Manager for the Private Sector Infectious Disease Center at Ga East in Accra. This facility was designed and built within 3 months during the period of lockdown by the built environment professionals and private sector players, with support from me and the government by extension. This presentation is based on my personal experience and research whilst working on this project with medical aids from the Ghana Health Service and Ministry of Health. I will be speaking on the subject, was health infrastructure unprepared? And I will link that to how Ghana responded and the contribution of the built environment professionals to this course. So let's take a look at the top 10 hardest hit countries when it comes to COVID-19. You find America at the top. But one will ask, all these countries in the top 10, what is the state of their health infrastructure? Once again, this takes us back to the question and draws our mind to it that it is not just about infrastructure, but it's about infrastructure that is tailored towards infectious disease control. Coming to Africa, Ghana to be precise, our health infrastructure comes in the following categories. We have teaching hospitals, regional hospitals, municipal and district hospitals, clinics, and community-based health planning and services, otherwise known as CHIPS compounds. This is in descending order of availability of facilities and specialist medical consultants or personnel. Their distribution is also concentrated in the same descending order from the more urbanized areas to the more rural areas, which have the CHIPS compound, requiring the least infrastructure. So in this shot, we have the general spread of our referral hospitals, or what you may refer to as regional hospitals. And this shows a fairly distributed centers across the country. Ghana recently had 4 more regions being added, so we are yet to get more infrastructure in those places, and all this helps in the decentralization of our medical system. The government adopted a strategy of early detection and isolation, and this meant that laboratories will be the key infrastructure to start with. COVID testing requires the more superior molecular methods, which was not the order of the day, and as such, there were not enough trained personnel in this field. The Ministry of Health has classified diseases and recommended how they should be tested. And Ebola and COVID are the new entrants onto this list. The Ebola outbreak in West Africa from 2014 to 2016 first brought to the fore the need to improve our laboratory infrastructure to take care of infectious diseases in that higher category. The veterinary services came in handy since they have the equipment and training for molecular testing and deal with pathogens that can cross from humans to animals and vice versa. The research institutions also had the real-time PCR machines, which actually became the backbone for the COVID testing within this period. I would say infrastructure for testing was also not prepared for the COVID-19 pandemic. So when it comes to our approved testing labs for COVID-19, you would realize that 70% went to our foremost research laboratory, that's the Noguchi, found in Accra. We had about 10% going to Kumasi Center for Collaborative Research, which is found in the Middle Belt. The remaining 20% can be shared over all the other support laboratories, both private and government-owned across the country. So on this map, we have the distribution of the approved testing centers for COVID-19. And you'd realize that there's a high concentration in the capital, Accra, that's at the southern part of the country. So this draws our attention to the need to decentralize some of these medical facilities across the country. The government also took on strategic interventions, the low state of the COVID spread in this part of Africa. The government secured $1 billion funding from the IMF to combat this pandemic. There was also a nationwide lockdown and closure of borders. Gatherings were all suspended. There were payments made available for contact tracers. There are those who went around tracing those who had made contact with infected people. We also had weekly COVID-19 updates by the president. Medical staff rather visited and picked up those reporting symptoms of COVID-19 rather than them moving to the hospitals in order to avoid spreading the virus whilst getting to the health facilities. We also had a feeding of the vulnerable in the first 2 weeks of the lockdown. There were incentives for frontline workers, both medical and non-medical, during the period of the lockdown. The government also provided free pipe-borne water from April 2020 to date, and this was to encourage hand washing and other personal hygiene protocols. There was free electricity for lifeline consumers of 50 cedis and below per month. Business Support Fund was also established to support those businesses heavily impacted by the COVID-19 pandemic. We also had health infrastructure upgrade initiatives. Case in point being the ambulances to all districts nationwide. The drone medical delivery system played a role, however little, in bringing samples from the hinterlands to the laboratories in the cities. The other forms of assistance to the government and the country, and we cannot overemphasize the benevolence of the Jack Ma Foundation of the People's Republic of, who brought us PPEs and testing materials, and this really improved the testing capacity of our laboratories. Our own private sector contributions cannot be forgotten when it comes to assistance. We had contributions from civil society organizations, private organizations, institutions, and individuals. Talking about the private sector, in the communal spirit of everyone lending a hand in this fight, so many ideas and good intentions were put forth. But there was a need for a leader to focus all the energies and goodwill. For the private sector, we found a leader in Senyo Hosi, CEO of the Ghana Chamber of Bulk Oil Distributors. As managing trustee of the Ghana COVID-19 Private Sector Fund, the following activities were undertaken. There was the feeding of the vulnerable during the lockdown, street children, hawkers, by-day workers, etc. There was also feeding for frontline workers. We had the supply of PPEs to the general public and medical facilities. There was also the building of a 100-bed infectious disease center. And as we speak, there are plans high advanced to build another 100-bed infectious disease center in the middle belt of the country, Kumasi. So in your shots, we have the pictures from feeding the vulnerable. And here we have the market women or the head porters who make their daily living, who make their living with their daily activities. So we're heavily impacted during the lockdown. Here we have our gallant men. They are the champions of industry. They put together the seed fund to start this project and opened up for the rest of the country to contribute. They also provided the leadership to the private sector to undertake these activities. Now, the involvement of the built environment professionals in this fight was a clear case of operation meeting opportunity. During this period, patriotism had reached its peak and everyone was willing to give a helping hand. It was locked down anyway, and everyone was at home. Having been in contact with Senyo Hosi and learning of the fund's intention to build a hospital, we quickly debriefed together a preliminary sketch design as our contribution to the fight. Soon after, the fund made its intention known to the general public. Once again, another leader popped up from within by the name architect Kofi Eselapia, who organized the rest of the built professionals to offer service for free or pro bono, as it might be referred in our line of work. So the built environment professionals comprise Institute of Architects, Ghana Institution of Engineers, Ghana Institution of Surveyors, Ghana Institution of Planners. We were also assisted by the Ghana Medical Association, the Ministry of Health, and the virologists from the Noguchi Medical Research. So here we have the gallant men and women who gave up their services for free in the realization of our 100-bed infectious disease center They are people from the built environment and the Ghana Armed Forces. So our approach to this project was that of a design and build. And the contractors and consultants all sat down together during the design stage. And at the start of construction, the design was still ongoing. So the project was sited on the premises of East Municipal Hospital, which was then a newly completed hospital. It's the first liability period, and was designated as a center for isolation and treatment of COVID cases in the South. Another advantage is this was not densely populated, and we were going to make use of the existing medical facilities to support our structure. We also had the staff at our disposal who had already been trained to handle COVID-19. So a brief concept, this is a brief design concept. We had a medical block, which is a clean area connected to a case management or ICU, which would be the infected area, and clearly linking them with the corridors. So that's the same concept as we have here. And we have our corridors going through the wards and compulsorily directing all assets to decontamination chambers before one exits the facility. So for an infectious disease center, typically there's segregation or zoning of spaces. And over here, you can see we have a staff entry on one side and a patient entry on the other side. The staff entry is demarcated yellow, the area demarcated yellow. And this area is assumed to be clean, and you didn't need any high form of PPE when you're in this region. All you would need is a nose mask and observing the general personal hygiene protocols. In the yellow zones, which are the corridors connecting the wards, you would need a minimal form of PPE, which our medical team have prescribed. But in the areas demarcated red, those are the areas that you have the actual COVID patients, and you'd have to be properly gowned as such. So as part of our design, we had a 2.5 biosafety lab, which is recommended for testing COVID. In our shot, we can also see the courtyards as we introduced in this mass to soften the whole mass and also give a sense of hope to the patients who are likely to be in this facility for at least a week. At the bottom left, we have our powerhouse that contains our generator and transformer. To the bottom left, we have our gas room, which serves oxygen and medical gases to the facility. So let's see this animation, and it shows the general mass of our proposal as it sits within the facility. You can see the skylights lighting the corridors to augment daylighting, our courtyard systems to also break the mass, our powerhouse, and the gas room also on the side there, all as part of the project. So let's see the notable features of this building. It's green, it's a green building, EDGE certified, with exemplary achievement in 23% energy savings, 28% water savings, 31% less bodied elements in material. We also made use of negative pressure within the buildings to make sure that any contaminated air does not escape into the environment. There's a one-way traffic as required for infectious disease centers. We used antimicrobial paint to slow down the growth of microbes within the space. We also have hands-free sensors and faucets and doors in certain areas as required in an infectious disease facility. So let's come to our construction technology. For our floor slabs, we have the in-situ reinforced concrete. Roof construction was a concrete filler slab with polystyrene blocks, the same material as we use for the walls. Our roof construction was the steel sheets on timber rafters. External walls, we have 3D wire panels with shotcrete on both sides. Internal walls had the same material. And for our floor, we use a vinyl flooring. Our energy measures, we had insulation of the roof, we have insulation of external walls, and air conditions with air cooled. Energy savings in light bulbs and internal spaces, and also the skylights also contributing to our efforts in energy saving. So this shows one of the milestones during the construction. And as I was saying, the Army played a key role in this project. Since it was a period of the lockdown, they helped in moving logistics to and from the site, and also helped with their technical men to supervise the construction. This shows the project at about 40% during the construction phase. So here we have our completed infectious disease center as part of our Ga East Municipal Hospital. It was finished at a cost of $7.5 million, a gift from the private sector, built environment professionals, the Ghana Army, to the people of Ghana. So let's look at the factors leading to the success of this project. The exigencies of the time. It was like a war zone. It was a period of war, and everybody put their shoulder to the wheel to fight this pandemic. Leadership of the private sector was also very key in pulling off this project. We also had support from the government. They gave us the land for free. Tax incentives were given to the project, and also all other protocols with procurement were removed, so we could quickly acquire materials and any other support we needed to get this done. We can't also leave out the commitment of the consultants from the built environment who gave their services for free. The discipline of the military was very key in meeting our milestones. We initially started with a deadline of 6 weeks, and we ended up with 3 months, which is a commendable feat anyway. The benevolence of our Ghanaian people cannot be left out. People were so generous. They gave their widow's mite. We had as much as $10,000 to as little as 1 cedi from the contribution of the average Ghanaian. For lessons learned, a people united in a cause can make a lot of things possible. We can also step out of our comfort zones or norms and take the alternative approach to solving our problems. One can always count on the goodwill of people to contribute to a worthy cause. When it mattered the most was the indigenous capacity of the citizenry that stepped up to brace the storm. This is a wake-up call to be self-reliant. Personally, this was a crash course in practical leadership and teamwork, having to work with people you have never met before to deliver an emergency project within a record time frame presented its own issues, bearing in mind all consultants were working for free. So we have the following recommendations for governments and everybody: to invest more into medical research and develop a biohealth preparedness plan. We also recommend an ICU or infectious disease model to be designed such that this department can easily be plugged into existing hospitals to improve and decentralize the nation's ability to fight such pandemics. Local capacity is to be developed in the building and maintenance of biosafety level 3 labs and get them certified for these systems. In conclusion, I would say healthcare infrastructure was unprepared for the COVID-19 pandemic, both in Ghana and worldwide, because the facilities were not actually designed to take care of infectious diseases. Thank you for listening to my presentation, and enjoy the rest of the convention.